Why are doctors so depressed? My name is Dr. Story. I've been a chiropractor for over 23 years, and I'm going to give you realistic advice based on my experience. There's been some recent things in the news regarding doctors and depression and what a doctor's life is actually like and what their daily routine is. And holy cow, but I was just looking it up. Likelihood of suicide by profession. Doctors have the highest rate of suicide compared to dentists, finance, real estate agents, electricians, police even have less suicide than doctors. Lawyers, farm workers, scientists, doctors are number one. Now the question is, why is that? It says in here too, 9 out of 10 doctors would not recommend young people go into medicine. Gotta wonder why that is. 1 in 2, 50% of all physicians believe their relationships with patients suffer due to the pressures to see more and more people per hour. So I'm going to give you my theory as to why you never hear of chiropractors wanting to commit suicide, but you hear of doctors wanting to commit suicide. The reality is, being a doctor, it's a very ego-driven profession. It's considered the highest level of society by some, and doctors are under a tremendous amount of pressure to perform, if you will. And unfortunately, at least in the musculoskeletal world, it's almost like a lot of doctors have shown up and they need a hammer, but they're only given a screwdriver. So they've got the wrong tools. If your only method of solving problems is drugs and surgery, you're going to miss out on a lot of people getting better. As a chiropractor, we use our hands and exercises and different therapies to help people with musculoskeletal problems. And the reality is 9 out of 10 people, that's what they need. So I'm bringing the right tool to the job. I'm not bringing the wrong tool to the job. So as a chiropractor, job satisfaction, if you will, is pretty darn high. When you think about if I get 10 people and we're going to have success with 8 or 9 of them, that's an extremely high success rate. And that's a lot of job satisfaction. Also, I'm under no pressure to see X number of people per hour. I'm the one that decides how much time I need to see a patient. Whereas most doctors are not working for themselves anymore. They're working for, a corporate America, as they say, and they're being pressured to see more and more people per hour. I have a number of friends who are medical doctors and physician assistants, and they tell me it's just insane how many people they're supposed to see per hour and to somehow solve all these problems, and they're stressed. Now the other thing is regarding medicine versus chiropractic in terms of like depression and suicide, is it's a very satisfying career as a chiropractor to actually have someone come in conscious, and we don't view symptoms as the problem. We view symptoms as a reaction of your body to the problem. So if your body is not functioning well, of course you're going to end up with symptoms. So we don't freak out that much about the symptoms, and we don't try to stop your symptoms. We're trying to solve the actual underlying dysfunctions that led to the symptoms. And what's fun is the person is conscious, we're able to do it, and very often the results start to happen real time. You can actually see it happening as it's going on. Contrast that with a medical practitioner the patient comes in, describes their symptoms, and you're supposed to somehow have medication that's supposed to stop their symptoms. You give them the medication and they leave. You never see them again. There's hardly any follow-up, or at least my experience has been there's hardly any follow-up. So what ends up happening, unless the patient of course is not better, then they can come back and complain more. So it's a very unsatisfying profession, and if you'd had a job that every time you went in you basically had very little success, that would simply not be fun. And that's only a theory I have. So whatever that's worth, let me know what your opinion is. Why do you think doctors are so depressed, and why is the suicide rate so high in medicine? Let me know. Put those things in the comment section below. If you have any questions, ask me in the comment section. If you like my videos, give me a thumbs up, subscribe to my channel. Thanks for watching.